My name is Robin Ferguson. I went to Berry College for my undergraduate. Then I went to the University of Georgia and initially practiced in Nashville. I came up here in 1995. And I love this area. I'm a person that if I'm outside, I'm happy, and if I'm inside, I'm not. I don't have any children except for the four-legged version, and I have quite a few of those. And I totally understand that pet-human bond because I feel it every day of my life, so. So when you're choosing a veterinarian, I think it's extremely important to get to know your veterinarian. I think that you need to go by word of mouth because that's a really good way to decide if somebody is who you want to see. And one of the things about choosing a veterinarian is that's the only profession. We have the only profession where we actually see the pet from the time that they're born to the time that they pass on. And I don't think any other professions have that same kind of connection with the client. So you really do need to establish a relationship with your veterinarian. And that would entail going to yearly visits so we get to know your pet. I've seen pets for 15 years now, and I could tell you every detail of every year when those pets came in, and it's important because I can usually detect if there's going to be a problem or what to do about a problem so that they live longer. For a typical exam, we'll actually do, my clinic cat is actually due. This is Morris. He's 15 years old, and actually we do a senior workup on him every 6 months. So just recently I did a complete CBC, a panel, so I know his liver, his kidney function. I did a urine sample on him, and I checked his thyroid, and luckily all is normal. So the first thing we would do is just look at him, and we want to make sure his eyes, he's really loving this, you can tell. He's used to getting loved on. And always you want to check their teeth. So we would just look at their teeth and make sure that everything looks pretty good. I have him scheduled for a dental, so he'll be getting his teeth cleaned soon. And I would just kind of check their overall health. We would look in their ears to make sure that they look normal. So we would just basically do a quick exam of the ears. You're used to getting loved on all the time, that's it. We always listen to their heart and lungs, and typically I'll listen for a long time. We'll just do a little shorter version of it, so we would listen to them. I listen to his all the time because he's my cat, so I know he's fine. He's a little heavy, but actually this cat's been on a diet his whole life, and he's old now, so we're a little bit lax on it, but. And then we feel his belly. I just want to make sure everything feels normal bladder, no tumors. I've got a kidney palpation there and his liver. And we usually just kind of check their coat. They're mostly looking for fleas or dander. And after that, we would vaccinate them. If it's a dog, we do a heartworm check and a fecal. So we just, and recommendations, like I would probably recommend he lose a couple pounds, but he is on a diet, to be fair. He's always on a diet. And that would be kind of your general exam. At this point in time, people would just question, any questions you would have, we would discuss. Okay, okay, you're done, sweet boy. You could help a veterinarian do a better job. I think that clients could definitely help us do a better job. And some of the thoughts I have on that are, if you bring a pet into the hospital that's not doing well, be organized. Be ready to tell your veterinarian exactly what's going on. And I always encourage writing it down. Write a list of, 2 weeks ago I noticed this, 1 week ago I noticed this, because when you get into the clinic, your thoughts get jumbled up. So write it down, and that way you're very organized when you get here to tell us what we need to know about your pet. I think cats should be brought in carriers. We recently just had 2 cats get loose outside as the owner carried them in, and thankfully they got them back, but anything could happen there. So cats should be contained in carriers. A dog should be on a leash. Lots of dogs come in here that the owners are like, oh, he loves everybody, he's friendly, and that's great, but what if the dog he goes over to is not? And I've had one bad dog fight wound before. I've had one bad dog fight wound in the lobby because 2 dogs weren't on leashes, and it's just preventative care so your pet doesn't get hurt. When you come into the veterinary clinic, be ready to discuss everything with your doctor. Go in the room. A typical veterinarian will come in there and ask you all the questions and answer all your questions, but you need to be ready to tell them that. So I would say put your cell phones away. Be ready to interact with the veterinarian right then. And another thing that really helps is I'll see anything. If you call me at 5:55 and your dog's been sick for 3 days, I'm gonna see it if you're a client here. But it would help me if at 5:55 I'm limited in what I can do. You know, we're closing, and now my blood has already gone out. So there's so many things that if you preemptively come in a little sooner, we could do more for your pet. We'll see them no matter what, but to get the best care for your pet, come in earlier in the day, and now we have all the time to work them up and figure out what's going on and do the best medical treatment. So all of these things are things to consider that would help us do a better job. So this is a female spayed dog, and she's done everything right. She brought it in, it had a bath. She brought her in for her vaccines. She got her heartworm test and her worm check, so we know she's clear. She's picking up heartworm prevention and flea control, and she's been spayed already. So does she need a dental? No. See, and she has beautiful teeth too. So she's the epitome of everything you should do right. And she wants to play with all the other dogs. So she's a normal, healthy, happy dog, and hopefully will go on and live a very long time with that kind of care. I think the owner's responsibility is to know your dog or your cat, to know when there's a problem, but be able to explain that to your veterinarian. And I think that's where the organization comes into play. You know, call your veterinarian if there's a problem, and between the two of you, you can decide if you need to be seen now or later. But it's hard if you wait 5 days. There's so many things that 5 days ago I could have helped, but 5 days later, it's hard. I had a dog recently, they waited 5 days on vomiting. It was a foreign body in the belly, and yes, the dog survived, but by the time we got in there to remove it, it had already caused a lot of damage, and this dog had to go through major surgery, whereas removing just a sock out of his belly wouldn't have been as big a deal. So, and was in the hospital, and also a lot more expensive because now you have a very sick patient. So that's just an example. You know, dogs that are drinking gallons of water and losing weight, diabetes is a big rule out, but you wait 2 weeks or 3 weeks and you've noticed a change in your pet, your dog's doing something different, and you just didn't, or even just call your vet and go, is this something I should be concerned about? But now they come in and now they're ketotic, which is much more dramatic than just a simple diabetic and here I'll teach you how to give insulin. Now we've got a sick dog in the hospital for a week before I can even get to the point of teaching you how to give insulin. And you know, hundreds and hundreds of dollars more. So the sooner you have a disease treated, very often, the less expensive it is too. So it's just, and it's better for your pet. You know, your pet doesn't get as sick. So I think that's an owner responsibility, and I think most people do a great job with it. But I would just make a phone call. Call your veterinarian and go, do you think I should have this seen if you're concerned? Yeah, that would be a take-home message there. In the human side, I'm the worst example. I don't go to the doctor all the time unless I have a problem, but I also know when I have a problem. I know that day I'm just feeling a little sluggish, and I know when something's wrong with me, but a pet can't always tell you that. The natural instinct of an animal that's not feeling well is to hide and be quiet. They don't complain and vocalize, they want to hide, and so it's harder to tell when a dog or a cat is sick. So I can walk in my house and I can look at all my pets and in one glance tell you if somebody's not feeling good. And that's when I think that we should know that maybe there's a problem here, or next day, my dog's a little off, do you think I should worry about him? So I just think that pets can't tell you, and they hide their signs so well. I mean, they're gonna hide all their sicknesses. So if you think there's a problem with your pet, I always say clients know more about their dogs than I do, or their cats. And I always listen to them. You know your pet better than me. If there's a problem, you're probably right. Then have it checked. Yeah.